research is basically looking at providing precise measurements of a patient and moving that into a method that the dentist or doctor can use for their treatment planning, reconstructions, and overall patient care. The way things operate right now, there is no easy way for a measurement to be done of that individual patient. So if they get a crown, when they go in, the dentist spends a long time using that individual patient as the fitting for making that crown. And what this does is it gives the dentist and the dental lab all the information about that patient so that they can do a precise fitting of that crown for that patient outside of the patient. So it saves the patient a lot of discomfort, and it saves the dentist a lot of chair time. For a patient, it's actually a very easy process. They'll come in and they'll have 2 scans done. The first scan will be a computed tomography, which they'll lay down on a bench and be slid into an electromagnet, which will basically perform a craniofacial computed tomography image. From there, they then are moved and seated into a 3-dimensional photographic system that takes the 3D representation of their face. And those 2 images are what we use to create the craniofacial system. From the CT information, we can create 3-dimensional objects, whether they be the entire skull or just pieces of the skull, a mandible or the teeth. And we can look at those things in 3-dimensional space for the dentist, so he can look at it in directions that he's never seen before.
Because we have an accurate capture of anatomy ahead of time, we can design the end result ahead of time. What's phenomenal about this is the opportunity to provide care for a patient that's far more comprehensive and precise.
As part of our creation of 3-dimensional images using computed tomography, we can support craniofacial surgery by developing rapid prototype models, in this case a mandible, where we remove the teeth and just have the mandible, and we can then give them to the surgeon where they can go in pre-surgery and do a test of their technique by cutting on the model, installing the prosthetic device before they ever go in and work on the patient. And what we've done is provided methods for doing this that has reduced surgery time down from about 8 hours for a standard joint replacement surgery to about 3 hours.